Are you a man over the age of 50? Are you thinking about prostate cancer screening? If yes, this video is for you. Today we're going to talk about prostate cancer screening, the benefits of using PSA for prostate cancer screenings and the drawbacks. Hello everyone, my name is Roupen. I'm an internal medicine physician certified both in Canada and the US, and I'm currently in my training to become an oncologist. So what are the risk factors for prostate cancer? There are several risk factors for prostate cancer. One, obviously, is age. As we get older as men, we are more likely to develop prostate cancer. Usually prostate cancer is more common in men older than the age of 50, and it's less likely to happen in men who are younger than the age of 50. The second thing is the background. Prostate cancer is more common in African Americans than whites and Hispanics, and also it tends to be more lethal in this patient's population as well. 3, family history. Having a first-degree relative, which is like a brother or a father with prostate cancer, increases the risk of having prostate cancer as well. Also, there are some mutations that increase the risk of prostate cancer, like the BRCA1 and the BRCA2 genes. If there is a mutation in one of those genes, it increases the risk of prostate cancer, and also in females, it increases the risk of breast and ovarian cancer. And finally, the diet. A diet that is rich in animal fat and low in vegetables also predispose men for prostate cancer. What are the tests that are used for prostate cancer screening? Okay, so one of the most common tests, or the main test that's used, is called the prostatic-specific antigen. What is the prostatic-specific antigen? It's a protein that is made in the prostate. At any given moment, there's an amount of the prostatic-specific antigen in the circulation. However, if it is elevated, it can mean that you might have prostate cancer. Why I'm saying this? Because there are many reasons that can lead to the elevation of the prostatic-specific antigen, or for short term, we can use the PSA. One of the most common things is benign prostatic hyperplasia. It's a benign condition. It's a condition where the prostate becomes bigger in men, especially older than the age of 50, and it can impair urination and emptying the bladder. But also there are more common things that can increase the prostate-specific antigen, the PSA, like bike riding, orgasm and sex. So those things also can lead to increase in the prostate-specific antigen, the PSA. That being said, it's very important to abstain from sex for 48 hours or riding a bike for 48 hours before using the PSA to screen for prostate cancer. But it's not the only test. Usually when you're at your family doctor or the general practitioner, if you are worried about prostate cancer, they might order a prostatic-specific antigen, or the PSA, and they might do a digital rectal exam. The goal of the digital rectal exam is feeling the prostate, because the prostate can be felt through the rectum, and any enlargement in the prostate can also correlate with prostate cancer, but it's not always the case, because as I said, one of the common reasons of prostatic enlargement, it is benign prostatic hyperplasia. What if the PSA is elevated? Usually, if it is mildly elevated, your family doctor or general practitioner might repeat the test again to confirm it is elevated. But if it is elevated on 2 or more tests, or if it is very elevated, the family doctor or general practitioner might end up doing a biopsy or ordering a biopsy that usually it is done by a urologist. A biopsy is inserting a needle to the prostate and taking a sample of the prostate and examining it under the microscope. So, what are the pros and cons of using the PSA to screen for prostate cancer? A large European study used the PSA to screen for prostate cancer in men, and they found that when they used the PSA, this decreased the mortality rate or dying from prostate cancer 20% after 13 years. Also, prostate cancer is very common in men and affects lots of men older than the age of 50. And the 5-year survival rate for early stage prostate cancer is 100%. When compared to the 5-year survival rate for a prostate cancer that is metastasized or traveled to other parts of the body is 30%. That being said, when the prostate cancer is in early stage, it's only in the prostate, the 5-year survival rate can sometimes be 100% even without treatment. So what are the arguments against using the PSA for screening for prostate cancer? Well, the same European study that I talked about, they found that we have to screen 1,410 men to prevent one patient from dying from prostate cancer. And if I have one 100 patients who tested positive with the PSA and I do 100 biopsies, 75 biopsies are found to be false positive. The biopsy shows that the prostate doesn't have cancer. Also, on the other hand, when we use the PSA to screen for prostate cancer, we can detect prostate cancer in early stage and we treat it. Some people suffer from the complications of the treatment. That being said, the question is, not every early stage prostate cancer is lethal. So, finding a prostate cancer at an early stage and treating it can lead sometimes to complications, and the same person might live with the prostate cancer without dying from it or without developing the complication of the cancer itself. So who needs to be screened for prostate cancer? This is very individual decision, and you should discuss this with the family doctor or the general practitioner. We usually start screening for prostate cancer around the age of 50, and we continue screening every 1 to 2 years with the PSA and the digital rectal exam, and we stopped around the age of 69. Some practitioner might offer screening beyond the age of 69 because they might have patients who have long lifespan. That being said, for patients who have short lifespan, they have other comorbidities like advanced heart failure or advanced COPD or other cancers, usually screening for prostate cancer is not recommended.